Thank you.
I will now turn it over to Rachel Baxter to talk about the Bridge program.
Hi, my name is Rachel Baxter, and I'm Behavioral Health Stable Housing Policy Lead for Transitional Aged Youth at HCA. I'm introducing the Bridge program that is contracted between North Star Advocates and the Healthcare Authority. The Bridge was created as a statewide collaboration and education program for community-based housing providers, behavioral health discharge planners, inpatient and residential behavioral health, and community professionals. It is also facilitated by young people with lived experience of homelessness. This program aims to reduce the number of youth and young adults who become homeless within 3 to 12 months of exiting an inpatient behavioral health setting as an unaccompanied minor. The Bridge does so by providing education to providers, and in the future, the Bridge can assist young people identify safe and stable housing within their communities utilizing a return to community plan. In this presentation, when I refer to youth, I am identifying youth ages 12 to 18 and referring to young adults ages 18 through 24. Youth homelessness in this presentation is defined as youth and young adults who do not have safe or stable housing identified upon exiting a system of care. An unaccompanied minor is someone that is under the age of 18 living on their own in the streets or unsheltered, or residing in a place that is uninhabitable, such as a car, or staying with others and are doubled up or couch surfing. Next slide. On this slide, you will find links to reports and detailed background information that gives a better understanding of the current climate of transitional aged youth experiencing homelessness and how the Bridge is essential to assisting our communities in ensuring safe and stable housing. Education prior to youth exiting an inpatient behavioral health setting. I want to briefly go over some key history and legislation that were important standing up the Bridge program. In 2018, the Washington State Legislature enacted Substitute Senate Bill 6560 that was created to ensure systems of care discharge young people to safe and stable housing. Some progress has been made in this area since this was implemented, and more work remains to fulfill the promise of this reform. For HCA specifically, we are identifying and assisting with unaccompanied young people being discharged from inpatient behavioral health treatment. In this context, the term behavioral health includes acute care facilities, including hospitals, evaluation and treatment facilities, substance use disorder residential treatment facilities, Children's Long-Term Inpatient Program, also known as CLIP, Western and Eastern State Hospitals, and Long-Term Civil Commitment, or LTCC facilities. In January of 2020, the Washington State Department of Commerce Office of Homeless Youth, or OHY, released a report titled Improving Stability for Youth Exiting Systems of Care, which outlined recommendations towards achieving the goals set forth by Substitute Senate Bill 6560. OHY developed the report and its recommendations in collaboration with the Healthcare Authority, the Department of Children, Youth and Families, or DCYF, the Interagency Work Group on Youth Homelessness, the Department of Social and Health Services, specifically the Research and Data Analytics Department, community partners, and through holistic, youth-centered co-design sessions with young people. The most recent data available shows that about 75% of young people exiting a Washington State system of care experience homelessness within 12 months of their discharge from an inpatient behavioral health program. The Bridge program is designed to change this trend so that young people who have the courage to enter treatment have safe and stable housing, in addition to accessing supports and outpatient services when they return to their community. In July 2021, HCA completed a report to establish best practice recommendations for strong and supportive communities for successful transitions from inpatient behavioral health facilities. Within this report, you will find that HCA recommended educational programs to identify best practices for transitional age youth discharge from inpatient facilities to discharge planners, managed care organizations, and community partners that work with young people during this stressful time. The report identifies the importance of provider and managed care organization collaboration and warm handoffs during care coordination to identify follow-up care, housing vouchers, natural supports, education, employment supports, and other basic needs such as food or ID cards. Additionally, this report emphasizes the importance of educating community providers on inclusivity, trauma-informed care, developmentally appropriate goal setting, identifying and addressing the stigma related to youth homelessness, and to identify systematic gaps that need additional innovation and support. Next slide. To support the recommendations outlined on the previous slide, the Bridge ensures discussions and topics presented during the monthly Bridge meetings are youth-centered and facilitated by those with lived experience of homelessness. The funding for the program comes in part from the Blake Bill and additional proviso funding during a special session of this year. Within engrossed substitute Senate Bill 5693, Section 215, it states funding was provided solely for the authority to continue and increase contract services to provide information and support related to safe housing and support services for youth exiting inpatient mental health and or substance use disorder facilities to stakeholders, inpatient treatment facilities, young people, and other community providers that serve unaccompanied youth and young adults. The Bridge program has implemented the data and reported findings requested of legislature by providing cross-system coordination and trainings that are youth-centered, establish education and awareness of resources, in addition to having conversations that are culturally and developmentally responsive, best practices for young people returning to their communities with behavioral health needs. Thus far, this has included developing relationships among service providers and giving a space unlike any other to discuss current trends, concerns, and to seek technical assistance. The Bridge also conducts a program spotlight during their monthly meetings to orient providers to other programs and resources that could benefit young people they are assisting. Some spotlights have included Kids Mental Health Washington, discussions regarding the Youth Diversion Infrastructure Program, also known as YDIP, with Away Home Washington, and some other organizations. In the future, the Bridge would like to establish a return to community customized planning, which will strengthen the process for young people who face housing instability upon discharge and for the youth to have the autonomy in deciding their goals to permanent housing. Each plan will include developmentally and culturally responsive safe housing options, supportive services, and enrichment opportunities to meet the young person's needs upon discharge. And lastly, the Bridge program envisions lasting reform, education, and securing additional resources. The Bridge will work in partnership with HCA in setting goals for future education and systematic change by identifying practice gaps, policies, and recommendations in connection that last and improve our community's understanding of housing supports essential to ensuring housing stability for those that have behavioral health needs. The next slide. The Bridge meetings are on the fourth Tuesday of each month from 1 to 2:30 p.m. To get involved and participate in the discussion or have your agency spotlighted during one of the monthly meetings, please visit the North Star Advocates website that's on this slide, as well as there's the executive director's information, Jim Theophilus, also on this slide, if you would like to connect with them further. Thank you.
Thank you.